Hey, what's up everybody? It's Neil from The Backworks. Today I want to talk to you about seeing the chiropractor for sciatica. If you've ever had sciatica, it's a horrible pain that will shoot down your leg. It can affect you any time of the day or even at night and wake you up. A lot of people, when they get it, the first thing they do is they'll Google, what do I do for sciatic pain? Maybe they'll ask their friends. And a lot of times it's go see the chiropractor is a suggestion. So will the chiropractor help sciatica? The short answer is yes. Because when you see the chiropractor, what happens is the lower part of the spine is where the nerve bundles for the sciatic nerve comes out of. And sometimes if those vertebrae here are stuck in this position, they can be pinching on those nerves. What I want you to do is picture a circus tent. There you go. Here's our circus tent. But here's the thing about it, it has to be anchored somehow. So every circus tent always has got these guide wires that come off of it. Now, here's the thing. If this circus tent is tilted over here because one of these guide wires are tight, there is no amount of pushing at the top that is ever going to get it to straighten up until you let out some slack right through here. That's how the muscles work when it comes to, or how it relates to chiropractic, because your hips, they don't just fall out of alignment. They're being pulled out of alignment because of tight muscles. Now, if you take a look at this skeleton chart, all of these bones and joints that you have here, none of this can move until a muscle moves it. So that's always something to remember. Not one single bone or joint can move until a muscle moves it. So when muscles are too tight, they're going to put too much tension on joints and then cause that pain. And so if you're getting adjusted over and over and over, that is just treating the symptom. Because where does it really start? All through the muscles. I just had a patient who had sciatic pain, and she said the first time that she had sciatic pain, she was desperate for relief. She was on Facebook, asked Facebook for it, and was looking around, and everybody on Facebook was giving her suggestions on who to go see, see their chiropractor. And so she finally got into one office, and she said when she got her first adjustment, it was like a light switch. It was just like that, instant relief, and the pain was gone, and she couldn't have been happier. The second time that she had sciatica, she went right back to that chiropractor, and after just a few adjustments, nothing was really changing. So the chiropractor said, what about if we add in some massage? We'll do some chiropractic with massage. So she was getting massages before her adjustments, and it really is a good thing to do, because if you can loosen up all of those tight muscles that are around the spine, it just makes that adjustment easier and it will last longer. Her problem though is that the massage and the adjustments weren't working. She was still having the same exact problems. So by the time she came into us, we went through a very thorough assessment, wanted to know history, wanted to know habits, what's the aggravating motion. And what we discovered with her is that her biggest problem when she felt it the most was when she went from sitting to standing. Now, she had already ruled out that it was an issue in the spine because of all the adjustments that she had. And so we looked at what muscle groups are involved in that transition from sitting to standing. And what we did is we found the pinch point that was deep in the hips and glutes. And so even though she had pain down the leg and across the low back, where you feel it and where it starts are almost always two different places. So think about it like this. It's kind of like if you are out watering your flowers and all of a sudden the water stopped coming out. Would you just sit there and just bang the head of the hose waiting for the water to come out? Or would you go look for a kink in the hose? Every one of us would go look for that kink in the hose. But when it comes to more traditional medicine, they really are only focusing on where you feel it. And with sciatic pain, not only does it go down the leg, but a lot of times you can feel it across the low back. And so that's where you're always wanting to rub. But what we do here is we reverse engineer pain patterns. And so in that patient's case, once we identified where that kink in the hose was, she started getting some pretty immediate relief, even just on the first session, because we were focusing on where it starts. So if you've got sciatic pain and you've gone through adjustments and massage and you're still not getting any relief, come see us, because it's what we do. Our backwork system is meant to reverse engineer your pain pattern so that we can figure out where your problem starts and start getting relief right away.